Facebook.
All right. We made it happen, huh?
Yeah.
Well, welcome everybody. Thank you so much for tuning in. I got a very special guest today. I've had the opportunity to work with Dr. Annie Truong for the last handful of years, and she's been doing some incredible things, not only in her integrated clinic out in the DC area, but all around the world, helping physicians learn how to use their body's own ability to heal using PRP and regenerative medicine to do a lot of amazing treatments that we're going to discuss today. So thank you for joining in. And at any time, feel free to leave any questions that you might have for Dr. Truong in here. I'd love to get those answered. But first, I'd like to introduce her. And Dr. Truong is a board-certified physical medicine and rehabilitation medical doctor and the founder and owner of Truong Rehabilitation Center in Fredericksburg, Virginia. Dr. Truong does regenerative medicine for musculoskeletal, aesthetics, and sexuality. She is the 2018 Entrepreneur of the Year from the Regional Chamber of Conference. She was named a top doctor by Northern Virginia Magazine for 3 consecutive years. She's also a best-selling author, internationally well-known speaker with over 25 years of experience. She's earned the reputation as a profound, engaging, and influential keynote speaker on regenerative medicine for sexuality. She uses her global platform to teach allied health professionals and doctors all over the world. She's a medical correspondent for America's News Network. Dr. Truong is also the president of Entrepreneurs Organization for Richmond, Virginia. So thank you so much for the gift of your time. I know it's a busy position for a lot of doctors that I've had the pleasure to meet as they transition to virtual. You've already had sort of an integrated center that has already been on the map. So tell us a little bit about how you got into integrative healthcare and primarily regenerative medicine, Dr. Truong.
Oh, wow. That has to, thank you for having me on the show, JR. I've known you for, wow, so many years now. It's like, I've forgotten. I remember meeting you multiple times at conferences, and finally I decided that, you know, we were going to work together. So I'm grateful to be here with you again. So that, for me, how do I get into integrative medicine is that, you know, I'm a pain management, physiatrist. So, you know, I'm, you know, an MD. I focus on allopathic medication and interventional injection, cortisone and medicine. And I realized in 2002 that this isn't worth it. You know, it's not working. It's not making my patient better. I'm actually making my patient worse. And I'm not really making long-term impact on my patient. So I started learning acupuncture. And acupuncture actually opened up a whole new world for me in looking at the patient as a whole and not just at the symptom, and that healing comes from the whole body and mind together. And from there, I learned about PRP, because I was finding that doing cortisone injection was really just a pad, was not for long term. I needed something that will help my patient for longer term, that really treat the source of the problem. And 2005, I found out about PRP with prolotherapy. And at the same time, I was learning both, and I started doing PRP and prolotherapy to the joints and find great success. And then in 2009, I added that, and then in 2012, bone marrow. So my evolution was really to find a way to treat patient source of the pain and to address the whole person. And so by that, I started my practice in 2000 and was just doing interventional procedures. And then I added a chiropractor, I added massage therapy, I added IV therapy, and then physical therapy. And we are under one roof, and we all have shared the same EMR system. And we all meet about the same at the patient, and we have an integrated approach to the patient. We all do different things, but all together is The focus is getting the patient better in the best way possible without minimal medication. I can't remember the last time I wrote a pain medicine, a prescription, or even a muscle relaxers. And of course, our goal is to get patients back to life. In 2014, I added aesthetics and sexuality to my practice by using PRPs and other stem cells as an adjunct to treating patient pain. So our integrative approach is really addressing patient from head to toe, and they see us. Most of the patients see us because they just want to feel better. In fact, they come in and say, "Make me feel better. I'm just not myself." So from that approach, I ask them what their priorities and what's the short term and long term, and depending on what their priorities are, depending on what we can do for them as an a la carte or as a package.
Okay, I have a question that I often ask is sometimes the alternative, call it acupuncture, call it PRP, call it nutrition, exercise, is by a lot of medical professionals, just like yourself. You went through getting your medical degree, a doctor, you were treating with narcotics, you were treating with cortisone, some of those things that were managing but not helping your patients. Sometimes you basically have probably spent the last 10, 20 years having numerous conferences after numerous conferences, continued learning, continued education, continuing diving deeper than what maybe many of your colleagues have, but yet often they say that's outside the box and there's no evidence. Where you come from the same schools, you come from the same teaching, what would you encourage consumers to recognize? You maybe have the same background, and why do you think it is perceived that this is somehow outside the box, or that you didn't get the same education that they have when you had the same education? How do you begin to kind of unfold to those that look at this as outside the box?
Well, the bottom line is, do you really, to talk to other physicians, is why do they want to think outside the box? Is because we know that the current medical system does not work to treat. It's really disease focused rather than healthcare focused. We're not looking at prevention. We're just treating symptoms, and we're treating it for short term. And then we're pushing medication. So it takes a physician to realize that, and what do I want to do for my patient? Do I really want to make a long-term impact for my patient? And do I want to treat the source of the problem rather than just the symptom? Do I just want to see a bunch of patients and and just pad it and just have them come back next month? That was one of my frustrations, was that I would see the patient, but I don't want them to come back to see me next month for the same problem, because I get frustrated as much as they are too. So I want to treat them and don't see them for years on end, or they come back for another problem. And so that was what the impetus for me to find something that treat the source of the problem, so that way it can be longer term. And so it really started with that the physician believed that they want to do the right thing for the patient. And oftentimes when you go outside the box, it's a lonely world, but there's a lot of us there. We just go to the conference we go to, and we see that. But it is outside the box. But I think that in time, and especially now with everything that's going on with COVID-19 now, I think that we'll focus on more preventative care and more of total body, mind body care, rather than just medication and surgery at this point. So for me, it was trying to do the right thing that I feel was right for my patient. And oftentimes, yes, I've been called crazy or hocus pocus doctors because of my approach when I first started doing this. But that's when I was doing acupuncture. When I started doing PRP, surgeon will call me, hocus pocus and so forth. Then a few years later, they call me and ask me to join their practice. So, and now they're doing it. They're doing the same thing that they were calling me hocus pocus for, and doing PRP now for the joint that I was doing back in 2005. So it come full circle. And I have to give you an example. The surgeon that did talk about arthroscopic knee surgery, when he first came out with that idea, he was laughed at, ridiculed, was kicked out of his society because they thought that he was just crazy. And then I think like a few years later, they made him an honorary member, and he was an innovator. So I think that if you feel that you're doing the right thing for the patient and the patient's improved, that's really all it counts. It matters.
I've always said, and I've heard the quote, and I heard it one time, and it just stuck with me, is no conformist has ever changed the world. So meaning, if we think healthcare can be done better, is why wouldn't we do something? Several years ago, people said there wasn't research. Now there's so much, anecdotal evidence, meaning you're seeing patients get better all the time, but there's level 1 studies, there's Prolo's been around for, 30, 40, 50, 60 years. So people are catching on. It is exciting to see regenerative medicine now being done in surgical settings, now being able to combine. I don't think they have to be one or the other. If I want surgery, just like when I had my Achilles, I had stem cells at the same time. It really sped up the outcome. I mean, 20 or 12 years earlier, when I was much healthier, it took 18 months to fully recover. 2 years ago, it took me 6 months to fully recover when they're combined at the same time. So there's so much innovation. And one thing that I brought you on to talk about, in addition to medical fitness, is thing that's excited me is our model was considered outside the box with functional medicine 12 years ago, and so was regen medicine. But you also engaged with us for medical fitness, meaning teaching people how to sleep, eat, move, nutrition, all the basics. And a lot of people advocate and have always done this. I knew a lot of allopathic doctors that are in conventional systems that do encourage lifestyle. So it's not that they don't. There's that common ground that we found between all groups. However, as you mentioned, they have more of a volume game. They're set to seize disease. Here it goes. So tell me a little bit about your view on, in that model where it's volume, they're forced to see 20, 30, 40 patients a day. How do you find the time? How have you found the time to teach or educate patients on how they can, make lifestyle changes to be a part of their care team as well?
Well, yeah, that's a good question. Well, for me, in order to really make an impact on my patient, I realized about 2 years ago now that I cannot be a cog in the wheel and take insurance at that time, because I knew that in order for me to even pay my bills and pay my staff and pay for my house and put my kids to college, I had to make a certain amount. That means that I have to see 30 patients, 40 patients in a day. And then, if you divide that, that's going to be 10, 15 minutes, and that's including procedures. So I didn't want to be a cog in the wheel. I didn't want to be an assembly line with my patient, and I wanted to make a bigger impact. So 2 years ago, I decided that I wasn't going to take insurance anymore, and we were moving toward more of a non-insurance practice. And that was the best decision we have, because we now spend 30 minutes with our patients and an hour with a new patient to address lifestyle, diet, and nutrition and exercise. And just really, I would sit down and talk with them and really find out what's really moved them and what their needs are that we can help with or we cannot help with, and establishing a rapport. So once you do that, then the rest of the work is easier. So in order for me to really make an impact, I have to realize that I'm not going to make an impact with just seeing a patient for 5-10 minutes and then rush out of the room. And that starts with the evaluation, and then we do the procedures. Following that and the procedures, we allocate plenty of time for our patient. But I'm what the good part is that I'm seeing less patients, but my revenues is the same or even better with less stress and with less staff. So, it's a win-win situation for our patient and for myself. And, I was getting to be kind of burnt out, when you're in that day-to-day grind where you have to grind through and just to get by, it was not something that I knew that I wasn't going to continue for a long time.
So you made big changes to better serve your patients, get better outcomes. And here's what I want everybody to know. No way would you have probably stayed in business at that time when people are used to paying with their insurance by switching to a cash model if the number one thing didn't hold true, meaning you got better outcomes for your patients. Your patients were happier, even though they're having to pay out of their pocket. And what I tell people is you usually have a $1,000 to a $4,000 deductible if you own your own business, even higher. And if you are continuing, let's just say you had knee arthritis, going for lubricating injections or cover-ups or even surgery, you are paying that regardless. And that is one of the more aggressive forms versus half the things that you mentioned: acupuncture, lifestyle things people can do on their own, PRP. These are safer, more minimally invasive and conservative options that, in our opinions and in a lot of research, they get better outcomes. So let's talk about some of the outcomes you see for musculoskeletal before we get into the sexual side of what PRP has been able to do in your practice. But tell me a little bit about some of the outcomes you potentially see with either fat or bone marrow, or cases that would have been surgical that you've seen dramatic outcomes with.
Well, that's the part that really makes my day, is that to see a patient come in limping. I will tell you, there's a patient I saw about maybe 3 months ago. She was only 66, just retired, have worked her whole entire life. And she cannot walk at all, cannot take care of her grandchildren, and was having just a hard time walking just for her basic everyday life, and going to the bathroom, changing her clothes, driving. And she was walking on crutches. And so she came in and to be evaluated for a second opinion. She was actually 1 week away from having knee replacement surgery, because the surgeon told her that she was bone on bone, and that the only way to help was she did need to have a knee replacement. She only had 1 cortisone, and that was it. She was a little bit overweight, but she was walking on crutches. Came in, I evaluated her, and we discussed certain options, and we decided to do the bone marrow and the bone marrow and the fat and PRP, because she had moderate to severe arthritis and range of motion restrictions. So because of the severity of her arthritis and the impact upon her function, we pull out the big guns, which is the bone marrow, the fat, and the PRP. And 3 weeks later, she walked in without her crutches and danced down the hallway to, when she came back for her follow-up. She's not 100%, but she was at least 50% better. Her knee was not swollen as much as a watermelon. She's able to get out of bed in the morning, go do her activity daily living, was able to drive. And for her, that was a game changer. And to walk without crutches and even though she has a lot more to improve, it just changed her life. So the point I'm trying to make is that, I see that more often than not, and the reason why we see a lot more better outcome is because of patient selection and education in the beginning. It's not for everyone, and that's why we do a thorough consultation to determine who is the best candidate and set an expectation up. But what we see is that typical scenario, what I just described to you, is limping, walking in crutches, and unable to even change your clothes and drive. And now, a month later, walking in and dancing down the hallway, and she was able to resume her activities, helping her daughter take care of her grandkids, and that's what we see. We see tremendous changes like that to let us know that we're doing the right thing, and this is not just placebo, obviously, because we see that probably around 95% of the time. And the reason why we have, like I said, I mentioned before, we have good outcomes because of good patient selection and a thorough onboarding process when patients come in.
Absolutely. And I look back, and for instance, as before Dr. Baumgartner did my first stem cell, he says, let's relook at your labs. Let's make sure you're in the best health, because bad blood can go everywhere. And that's what we did. And that's how you take the integrative approach as well. You also mentioned something in there is patient selection. So a lot of people, just like me, before I was told I needed knee replacement, I was bone on my medial side. So essentially, my outcome when I'm at that level is probably less than if I had my torn meniscus, 8 years earlier and I was hit the first time. So I always tell people, well, I've had this creaky shoulder for 10 years or so. Should I go now, or it's not that bad? And I always say the sooner you can get it, it's just like an oil change. It's just like you want to keep that going. And so many people wait till they are bone on bone and they're the worst case. How often do you see, I've needed the knee replacement and I was back to playing rugby 18 months later. So meaning I've seen dramatic outcomes with patients that weren't the greatest candidates, but I see even better outcomes when people are earlier in the stages. So how many, like with shoulders or hips or something like that, when you see earlier pathology in a healthy overall person, do you see better outcomes compared to somebody that's later in the game and just a week away from joint replacement?
Oh, definitely. I mean, I make the analogy of the same analogy of like your car. If you hear a little sound in your car, you're going to bring it to the mechanic and he's going to be able to fix it. But you don't wait until your car, die on the street and smoke start going up and, you can't drive anymore, right? But sometimes we do that to our body. We wait until we cannot walk anymore, or wait until it's you can't function, then you go see the doctor. So that's really, severe. So the earlier you start, the less the damage on the tissue, as in the joint or the tendons and the ligaments and the muscle, the less the damage, and therefore the more of an improvement you have, immediate as well as long term. It just makes sense, right? If you start with something that is mild, then you get a lot more out of it versus somebody that starts with severe symptoms, and they most of the time they'll get more pain reduction, but not so much as in regeneration or rebuilding, because a lot of the building blocks are gone. So, when I see patients like that, I'm very transparent with them that this is what you're going to be expecting. If you're severe and you don't have a lot of cartilage left, it's going to help you with reducing some swelling and reducing pain. And we're going to do this, and that will give you this, between maybe 1 to 3 years at max, and then you're going to need another one. Versus somebody that is in their 40s, they just have a slight meniscus tear, some very mild arthritis. Those are the patients that's going to go a long way. I even with those patients in the years past, I've just done PRP on them with intra-articular and extra-articular stabilization, just plain old PRP with platelet rich plasma. And they do very well. I mean, some of them, in fact, I haven't seen for years. They come back for another area for me to do the PRP on. I just saw one today that I did his left shoulder. He's a firefighter. He's 32. I did his left shoulder 7 years ago. And he had a mild, small rotator cuff tear. We just did PRP. He's absolutely fine, work out, doesn't have any problem with that shoulder. He actually came back for his knee. And that's because he knows that if he start early, he's going to go a long way. And we just did his knee today with just plain old PRP, and he just has chondromalacia patella. And I know with him, he's probably going to have years and years on end with that. So the main thing is start early. As you know, treat your body. I would tell patients, treat your body like your car. You know, you put an oil change and maintenance on it, and then when something goes wrong, just bring it to go see the doctor early, because if you do go early, you're gonna get a lot more mileage out of that.
Absolutely. So let's talk about sex, the big
Yeah.
word. So a lot of people have no idea. They've been, again, in the allopathic world, and there are certain treatments and medications out there that can help. But again, they have their side effects, they have other complications, and they don't always work. And we've seen the powers of regenerative medicine musculoskeletally and even systemically. Let's talk a little bit about what you see for helping treat ED, helping women with orgasms, you name it. So let's break down what is possible for men and women to improve their sexual health overall, and maybe their performance.
Well, I tell you, let's start with the men. It's the men, as in the men, is Mother Nature knows, wants you to not be vibrant when you get older. And that starts around 44 years old. You start your testosterone level. Testosterone is a hormone that makes you male. It starts to gradually go down around mid 40s. And at 50 years old, 40% of men at 50 years old have ED, which means that their testosterone level is 40% less than what it was when they were in their 30s. When they're at 60 years old, their testosterone level is about 50 to 60% less than what they were in their 30s. And at 70 years old, it's about 60% less than it was when they're in their 30s. And testosterone is an integral part of being men. So when you have low testosterone, you'll see symptoms of less decreased focus, less energy, loss of muscle mass, mood instability, and then erectile dysfunction. Now, erectile dysfunction, interestingly, is also related to factors of metabolic syndrome, obesity, cardiovascular disease, diabetes, high blood pressure. So if you're young and you have high blood pressure, you have obesity, and you have blood pressure, that's actually a sign that you're also going to have blood pressure. Blood flow problem that will contribute to ED as well. So ED is not just, it's not just with age, it's also contributed by multiple medical conditions, irregardless of age. I'm seeing patients in their 30s with ED. And I want to say that ED actually ranges all the way from mild, where it's just less sensitivity, it just takes longer, all the way to the spectrum of premature ejaculation to inability to have an erection. So it's just not just having an erection, it just takes longer, or premature, or so it's a whole spectrum of that. And it's not just for older men, it's for younger men as well. So having mentioned about the multiple contributors of ED, when I see the patient, you have to look at all that. You have to look at what their comorbidity, what's their BMI, are they exercising, are they getting enough sleep, and what's their diet, and then their age. And then then I look at the blood work at their hormones level, and also what their inflammatory status is as well. Too, we have a machine that that can measure the inflammation level, but we also look at blood work for inflammation as well. And what the first thing we start off when we see patients with ED, we start off with recommendation on their diet first,
So let me pause you right there. So this is what I hear you saying to summarize what we've already talked about is people come to you and they say, I have ED, or I have osteoarthritis, or I have diabetes. And the fact of the matter is they didn't just get it when they took that blood lab and it shows now that they went from pre-diabetic to diabetic. So meaning this started 10, 20 years ago through inflammation in the body, of testosterone starting to decline naturally as we age, blood sugar imbalances, inflammation built up in the body. So meaning everything that we've talked about, which doesn't get addressed in allopathic medicine, is basically, here's your ED, here's your Viagra, here's your blood pressure, your diabetes, here's your metformin, versus to get the best outcome, you're saying, let's go back to the causes and start giving the lifestyle recommendations. And once you start cleaning that up, now let's take that cleaned up blood and let the body start to restore and regenerate itself. So you've helped somebody, you evaluate, you look at their bloods, you find some root causes. Now you're going to use that nice clear blood that's going to work a little bit better. Tell me, what are some of the benefits that you're seeing treating ED with PRP?
Well, yeah. So we first we look at lifestyle, and then look at the blood work, and look at the hormones, and then PRP, which is platelet rich plasma. We know that it can increase angiogenesis, or new blood vessel formation in any tissue, and that's the endpoint. Is that it increases blood flow to whatever organ you injected in, either the muscle, the tendon, the ligament, or so with the genitals. If you put it into there, it's gonna promote more blood flow to the area. Of course, we always do a nerve block first, so that way it doesn't hurt, and we have laughing gas. But if you put in PRP into the male genitalia, you actually will bring in more blood flow. So how I describe it is that, ED, it means that you have a pipe, you have two pipes that run through your genitals, and then as time goes by, the pipe gets smaller, so it's less blood flow flowing in. So how the PRP help is that it opens up those pipes a little more, so you get more blood flow into the area. So depends on patient's symptoms, and how long they've had it, what their comorbidities are. We start with the PRP, and sometimes we would have to add, it's called shockwave, extracorporeal shockwave therapy, which uses a sound wave and transmitted into mechanical wave that it's like a tap into the genital area. What it does is that it stops the leakage in the blood flow in the organ, and to promote, again, more blood flow. So it depends on patient's symptoms, how the severe they are. We would either use PRP alone, or PRP with shockwave therapy. It's the same shockwave that you would hear about, the Gainswave shockwave. But there's two shockwaves that we use. We use focused shockwave and the radial shockwave, and it depends on patient severity, depending on what we use for. Shockwave, though, it is a home run for a patient with Peyronie's disease, it's a cure for that, actually. And then along with our third triad is we add testosterone hormone, either it's in an injectable form or in implantable pellet. So it's really a customized treatment plan. So not everybody gets PRP or anything like that. You get the blood work, you see where you're at, you see what your comorbidities are, how long you've had the symptoms, and where you at on the erectile dysfunction scale, and determine what we're going to use and when. And that's what the treatment should be. And what we find is that when the men come in with needing to have Viagra or Cialis to make it work for them, well, with the treatment, they don't need the medication anymore. They can get back to spontaneous, sex life, and can really enjoy their sexuality. And my end point is that most men think that, hey, I'm old, I have to accept this, I'm getting, part of getting old. That's not true at all. Mother Nature wants you to, but we're in 2020 here. We can you can enjoy, vibrant sexuality all the way until your 80s, and, until the day you die. And the recent studies have shown that actually, if you have sex 3 times a week, it's actually decreased stress, better quality of life, and you live longer, no matter how old you're at. So some of my patients say, well, I just have to accept the fact that I had to rely on medication. I told them, no, that's not the case at all. It's kind of like when patient doesn't know that PRP can help with their knee pain. They just know that the only option for me is a knee replacement. Well, no, there are other options for you. And I'm very passionate about that, and getting the message out there that there are other alternatives to ED rather than just the blue pill and just having to live with it, or a penile implant. And in fact, we work on patients with penile implant that had it, and to increase sensation as well. So, the bottom line is that there is an alternative.
Yeah, absolutely. And you and I have been in, high-level masterminds, different regenerative courses, training our models all over. Dr. Truong, if many of you are just tuning in, has been coming to our business summits for doctors the last several years, and trains her techniques on regenerative medicine of all the different body parts we haven't even touched in right here. But one of the common marketing phrases is paid, laid, and live forever. That's what people ultimately want. And ultimately, that's what you're delivering, because as you mentioned, if they have low testosterone, productivity's down, depression creeps in. For men, if you're not able to do, what you think you're supposed to be able to do, it can be a deep and dark and depressing place that for a lot of people that aren't able to perform that way. So once you start increasing testosterone, recovery, energy, focus, as you mentioned, starts coming back, then we're talking about the laid part. If it's working spontaneously, you're feeling better. And then when we're looking at hormones, internal health, reducing inflammation, we're talking about extending longevity and everything you're doing, even if they're just coming for ED. So really, these integrative models are focused on all 3 of those areas, where that is completely missed in a lot of just 10-minute visits. So before we get into some of the OShot that you perform for females, what are some of the benefits besides being spontaneous? I've heard of reported outcomes of increased orgasms, increased girth, length as they're going through this. What are some of the outcomes that you're seeing for your best performing patient?
So for the PRP injection or the PShot, it's definitely increasing sensation and increasing girth, but not so much length, but increasing girth. And also the ability to have spontaneity, and it actually will treat premature ejaculation in cases like that, and will treat Peyronie's. I see a lot of patients with Peyronie's, and it's a cure for that, actually. And Peyronie's and ED goes hand in hand. Too, and Peyronie's, what's the basis of Peyronie's? Inflammation. Peyronie's is an autoimmunity, so it's inflammation, and we know that PRP is anti-inflammation, and so it will increase blood flow to the organ as well, and it just creates a more healthier organ. And I actually see that, and depending on how many PShot you do, you can actually see changes in the girth that are quite visible. So when men feel more sensation, their erectile capacity is also improved too, and it gives a sense of confidence. The confidence, it improved relationship. That's what I see. I almost call myself a marriage counselor, because I've improved a lot of relationship with with my patient with their wives, and they do well. They bring their wife in, and we do an OShot with the wife, and some aesthetic work as well. So what's gratifying is that you actually see beyond just ED. You're seeing a relationship. You're seeing this quality of life that just goes beyond what the mechanics are.
Absolutely. And when we started introducing this after you helped train us and everything, we had our fitness side. And for women, what I would typically always hear as a trainer for years is no jumping exercises, JR. I don't want to wet myself. I didn't prepare for it today. So I've seen incontinence, I've seen, but then on the training side and health coaching, a lot of people start opening up about stressors in their life that's led to either weight gain or inactivity. And oftentimes, it's reported that, again, the lack of sexuality or connections in their marriage. But ultimately, we see that women maybe don't have the same time overall, maybe ease of orgasming as men do. Like as a man, maybe every single time I've ever had sex, I orgasm. I didn't always hear that from different women. So tell me a little bit about, the women cases that you see and some of the benefits that happen on the other side of it.
Right. So the woman, the analogy of the PShot for the woman is called the OShot, and it's really there for orgasm shot, which is PRP injection into the clitoral region and into the G spot. And it's very well tolerated. Again, we do a nerve block to numb the pain and a numbing cream as well. And immediate within 3 weeks of doing the OShot, immediately it will stop urinary incontinence. That jumping jack, limitation that you talk about is that it stops that, because what it does is that it decreases inflammation to with the G spot, but the G spot goes all the way up to the bladder. So it strengthens your urethra, so you can hold in the urine better. And that's the immediate thing that I see in patients right away. Then that's early. That's 3 to 4 weeks, and that can last up to about a year and a half. And then we also have patients do Kegel, so they respond more to Kegel. So once you put the PRP into that area, it also strengthens the vaginal muscle. So for women, as you get older and as women have children, the vaginal muscle become lax. Gravity acts on it, and then when menopause acts on it, the muscle loses, and the muscle become atrophy, become weaker, and then having children, it stretches that area as well. So lo and behold, you get urinary incontinence, but doing the OShot, that will strengthen those muscles there to make it tighter. And inject into the clitoris will also increase sensation. So women will have better sexual response and have increased sensation with orgasm. And some of the women, some of my patients tells me that they actually ejaculate. Women ejaculate as well as men also too, but not as much. But once we do the OShot, they feel that there's more lubrication and that they're able to have vaginal ejaculation. And another thing too is that for women that are in menopause that cannot have hormone replacement therapy because of breast cancer, doing the OShot will treat vaginal dryness. Which treats it, and vaginal dryness can become very, very disabling. It's painful just to go do number one, and so it's a great treatment for that. And it also OShot also help with women that have scar tissue from surgery down the area or for multiple childbirth. That they have scars in the area, and sometimes the scars become hard and it's painful, and so injecting PRP in those scars will actually relieve pain in that area. That's called dyspareunia. So relieve vaginal pain, because sometimes it becomes so painful that a female cannot have sexual activity with her partner. with that. And actually, one of my first OShot patients was a patient that had dyspareunia and hasn't been intimate with her husband of 5 years since she had the baby. So she had the baby, had a lot of scarring from that, and had the baby, but hasn't been intimate with her husband because it's just so painful for her. We did the OShot, and literally she came back and see me in a month, and she said, oh my God, I have not been intimate with my husband in 5 years. Now I can. It's the first time, we had sex in 5 years, and it's just, it changed my life. So, that's gratifying to hear, but we actually see that. It is actually a cure for the dyspareunia. I think I cover most of it. It also will help with bladder, irritable bladder as well too. So with irritable bladder, because irritable bladder is really inflammation. So it will help with that as well. Now, we also do shockwave therapy to the female genitalia as well. And the same way is to increase blood flow and tighten the muscles in the vaginal wall.
So overall, what this has given people is either an opportunity to be more sexual, to perform better, to have better orgasms. Doesn't seem like any way or reason somebody wouldn't be able to do it. Tell me maybe something that is, why is the PRP such an effective treatment versus just other injectables, or what other people have tried to make these figured? When we talk about hair, face, breast lift, what makes PRP so powerful in these areas?
Well, like PRP is natural. It's your own blood. So you're not going to have any side effects of that. And PRP is platelets. So these platelets are floating around in your blood that is mixed around with your blood cells. And these platelets, imagine like a little disc, and the inside of it has all these growth factors. And when it's injected into an area, those discs burst, and these growth factors is released. So these growth factors stimulate three things. It brings special cells that go to the area to clean up the debris, to get rid of the inflammation. And then it brings in cells that help create new blood vessels called angiogenesis. And then it brings in cells to create more collagen. We call that fibroblast stage. So it's really like a homing device where you inject it, it calls these cells to go, hey, this area needs some work, macrophage come in here and clean the area, next, endothelial cells come in and create new blood vessels, and then fibroblasts come in and create more collagen. So that's what it does, is that it calls these cells to home to the area. And anywhere you inject it, either in the hair, the face, or the breast, it does the same thing. It brings in new blood vessels. When it brings in new blood vessels, then it carries the cells that are called the fibroblasts, and the fibroblasts will create new collagen. So the end point is new collagen production. You have more collagen, and collagen is what makes up our skin, our muscles, our ligaments, our hair, and our muscles as well. Our cartilage is made up of collagen, and once you strengthen that, you stabilize the area. So let's just say, talk about the female genitals and the male genital. Well, that's made up of muscles and soft tissue and blood vessels. So, and PRP, addresses all that. It brings in more blood flow, then it builds more collagen, so the muscle becomes tighter, stronger, and more responsive. It's almost like replacing old muscle with new muscle. So that's what PRP does. You already have that in your body. Like, for instance, you can stimulate that same response when you cut yourself accidentally. You have a cut, you see blood ooze to the area, and then in the next few days, you'll see a redness and a swelling, and then you see a scar being formed. It's the same process happens. It's just that, unfortunately, it doesn't happen spontaneously. You have to stimulate an inflammatory response first, or an injury, and by by a physician injecting the platelets into the area. You're creating the injury, stimulating the injury to start that whole healing phase.
That's a beautiful example. So is now, you know, when you do the face, so we didn't really touch on the hair, the face, or the breast lift. So collagen, number one in these areas. I don't know necessarily the hair and breast. So tell me a little bit, same technique, same process, but the outcomes that you're seeing in those areas.
Right. So for the hair, let's start from the top. For the hair, for both men and women, you inject in PRP into the hair along with vitamins and, you know, even some peptides into the area. And the end point is again, stimulating the follicles or the hair follicles that have a hard time coming out through the scalp. They're like seeds, but they're dormant seeds, so they can't spout out the hair. So when you're stimulating the PRP, the dormant seed will go, oh, okay, I have something to feed on. I'm gonna spout out some baby hair. So it helps stimulate the follicles to spout out baby hairs. Now, if someone is bald and it's shiny, that means they have no follicles left. That you can't do much about that. That got far too gone. But if you have thinning hair, yay, there you go. I would love to work on that. I think I tried to work on that one time when I was at Rejuve to do it. You were too busy.
I was on the dockets, but then we got a volunteer patient that was running everywhere, so I gave up my spot because they wanted it. But
I know, but we're gonna have to revisit that next time. We're gonna have to revisit that as well. You know, as well as the PShot too.
Yes.
No, but yes, your hair is perfect. Perfect, because yeah, it's not hair doggone. You have very immature hair there that we can spout out with those follicles that cannot spout through the scalp, and the PRP will help with that. The PRP help the dormant follicles that cannot grow out the hair. The PRP just give it a boost. The hair comes out, but the hair growth is very, very slow. It takes up to about 9 months to start seeing baby hairs come down. But the beautiful thing about doing this is that the hair comes out your natural hair color. So one day, PRP will be the treatment for gray hair, because if you have gray hair, the new hair that comes out is not gray. It comes out shiny. It comes out your natural hair color. Like, this is not my natural hair color, but if I was gonna have it, it would grow out whatever your hair color you were born with. So when I see patients, they come in and they have this shiny, full hair, and the hair is smooth, is healthy, it looks vibrant, it's just awesome. I mean, it looks 10 times better than a wig. You know, you can just tell that it's just freshly regrowth hair. And of course, with hair loss, you got to address the symptom, the source of the problem, what's causing early hair loss. Most of it is probably genetic, but inflammation too, metabolic syndrome, thyroid, vitamin D, vitamin B complex, and all of that contribute to hair health. So the same thing when you go down to the breast. Remember I mentioned about stimulating blood vessel growth and collagen. That's what the breast is all made out of. It's really, really soft tissue, collagen. So, and we inject into the breast. It doesn't not to make the breast bigger. It's really create a better cleavage. And it gets rid of those crepey skin, crepey pattern that a lot of women don't like, and the pigmentation in there creates a beautiful cleavage line that if you wear like a bra with that, is very beautiful. But one thing that we also see is that it does help with these horizontal lines here in the neck. If you do the micro needling on the neck, and then we also do that on the face. I mean, on the hand here as well. You know, a lot of women now don't like the freckles on their hand or the crepey skin on their hand, and that make them look old. And believe it or not, when you meet people, the first thing they look at is your face and then look at your hand, because you wear jewelry. You shake the people's hand and they're going to look at the hand and go, oh my goodness, that's a wrinkly skin. That has a lot of pigmentation there. You're old, So it's just first impression, I forgot to mention, you can do PRP into the face, like the vampire facelift or the vampire facial. And PRP facelift is injection of PRP underneath the skin on the face to stimulate the skin to be tightened, to get rid of those wrinkles, also get rid of the pigmentation. The vampire facial is using microneedle, which is a pen that has like 9 little pinholes that goes in and out the skin, create multiple holes in the skin so that way it will soak in the PRP. And that gets rid of pigmentation and smooth out the texture of the skin, make the pores smaller. So the vampire facial is really more to smooth out, to improve texture. The vampire facelift is to lift, to add more volume, because we also do that with a filler. And then you're injecting the PRP under the skin to stimulate the muscle regeneration, to tighten up the muscles, and it does a great job in giving you that nice youthful look. It's almost, I call it the lunchtime facelift. It only takes about 30-40 minutes to do. You come in, you come out, you look like you're 10 years younger. And then so we talk about the facelift, the breast, and the hair. But I talk about the neck, this horizontal skin here. Just the beginning of the horizontal skin, that would get rid of that. And the hands as well. So that's something that actually I haven't taught the hands. I've been teaching more of the face, but doing the hands in the neck area is something new that we've added recently.
That's huge. And you've been teaching doctors all around the world. This is, an adjunct, meaning you can improve if you have a doctor in a spa that's doing Botox or fillers right there. The plastic surgeons using this to get better outcomes. I didn't touch on it. I see the same thing with PRP. I'd imagine you'd use the exosomes the same way, which is a different topic, what some people are using on their face for similar outcomes. But the thing that I want you all to pay attention to is you can go to a lot of places and you could find a regenerative medicine expert to put PRP or stem cells into your knee, or somebody do it in your face. But there's very few integrated clinics that are addressing all cause. Just like Dr. Truong said, is I want to look at the hormones. I want to look at labs. I want to give lifestyle recommendations, nutrition, just you mentioned foods with collagen, bone broth, to the right different things that are going to help supplement, and also supplements themselves for your better immune health, function, and everything. So can you tell me what you think the factor is if somebody's just trying to go do the shorthand versus the comprehensive outcomes when you've seen a compliant patient jump on board with the whole program?
Well, it all starts with the onboarding process. So when we bring a patient on, we give them a lot questionnaires and questions, so that way we know what they're looking for. We know, we're transparent with them about what our processes are. We want to get buy-in in the initial part. We want to work with patients that want to help themselves, that want to be we want to be team members, rather than somebody that says, you help me, you do everything for me. If I don't get better, it's your fault. It's really a team effort. So that's what I mean by patient selection, the onboarding process, is to recognize that in the patient, because the patient's going to have to want to get better and to put in the effort to get better as well. We are educators, and we look at ourselves as educator and as a team with the patient. It's because I would only probably spend a few hours with them, but the rest of the homework is up to them, but they would have to put in the work as well. So if they want to put the work in and they're motivated to do that, then we can definitely make a big impact on the patient. And we could go long distance. And I like to see my patient get better for years. I mean, I don't like to see my patient every month. I like to take care of them and they do well. And then, I don't see them for years. And then we do a lot of virtual visits, to follow up on how they're doing. And I also try to treat a lot of anti-aging as well, like you mentioned earlier. A lot of what we do is really anti-aging optimization, because we don't want a patient to degenerate. We don't want them to succumb to the effects of aging. And because it's selfish for myself, because I'm undergoing that right now. So I don't want to age either, and I want to be vibrant and vital all the way until I'm in my 80s.
Well, you're definitely leading by example, Dr. Truong. I wish everybody could have been at some of our dinner meetings together. You're a hoot that walks the walk, talks the talk, does it all yourself, are fun, caring. You're a definitely different breed of physician. You're not the typical one. You definitely bring the joy, the fun, and
Thank you.
living it by example. And one of the biggest things that I have heard is sometimes people are scared of the pain. So especially when dealing with their genital areas. And I just want to assure you, everybody, when we put the cream on in there, most people said they haven't felt it. And if you're even looking musculoskeletally, I've had numerous knee surgeries prior and other surgeries prior to having stem cells and PRP. Surgery is going to hurt the next few days no matter what. PRP is just a few injections and nothing different, and then a faster recovery and outcome than surgery has ever been for me in any regard. So the pain, you feel it a little bit, but the genital areas, based on the creaming and the nerve blocks, I've heard are virtually painless. Now the head, on the other hand, I've heard of the pain creams and aging, and heard that's a little bit more of a sensitive area, but I've done laser therapies and that thing hurts. That thing really hurts. So
yeah, but now we have laughing gas.
Okay.
So we have a portable laughing gas where you breathe that in, and it's a mix of oxygen and nitric oxide together, and you're aware of what's going on, but you don't care. That's the feeling. Is that I tell patients you feel half drunk and half, you just don't care. I mean, it's not like you're drunk, but the moment that you take out the laughing gas and you stop inhaling it, within minutes you're back to normal. So you're not sedated, you're not dizzy, you're not nauseated at all, and patients drive themselves home. So, we do that now for PShot and OShot and all the procedures that we do. We want patients to remember it's a pleasant experience rather than an unpleasant experience, even though tolerable, but, we don't want to be the highlight.
Well, that's definitely next level there. So completely comprehensive is going to address the whole person and some of the root causes. Do amazing regenerative medicine, next level treatments. You've been leading the way by teaching this, researching, looking at all the components that go into it. So if you're a doctor listening, Dr. Truong, what are some of the training opportunities they have? And if you're a consumer, you're on the East Coast, or looking to be out in that area and wanting to have one of these amazing treatments, what are the two places they could find those two differences, Dr. Truong?
Right, it's all on our website. Our website is truongrehab.com, and under services, you can look at all the different services, and we listed there under detail. And for a physician that wants to incorporate this is something we can teach you within a day to a couple of days with follow-up training. They go under the physician tab, under physician training, and we do that once a month. We can even do it virtual if we need to, and I offer consultation afterward for just case-by-case basis. These procedures are actually, if you're a physician and you're used to injecting and dealing with the needle, you can learn on the weekend, and as long as you know the contraindications and the pros and the cons of that, it's easy to learn, but it's very high reward to add to your practice. Not only it will improve your patient life and treat your patient as a whole, but also your bottom line as well too.
Yep. one of the first things when we first brought it on under your guidance and training is we were a little bit nervous of marketing it. And what we found is when we did any PRP or stem cell, we were drawing blood anyways. So based on the recommendation of saying, would you like this add-on versus normally on these procedures can be anywhere from 1,000 to 3,000, but since we're already in there and it can be a quick procedure, we had a major, influx of patients just wanting to add it on to their PRP for their musculoskeletal injuries or pain. And that really made sense. So even if you're a practitioner that maybe doesn't want this to be the front and center that, draws away from your pain or sports and orthopedic practice or whatever, that really worked really, really well for us. And a lot of people wanted that. And the fact is, what we found is because people didn't know, we weren't marketing it, when we offered this, some were saying, I would prefer to have this first, because when they don't have their sexuality,
Yeah.
Vanity is very, very important to people. Have you ever found that as well?
Oh, yes. First of all, I want to say that those doctors that are already doing pain management, musculoskeletal, okay, if the patient's in their 40s and their 50s, if they're already having pain, that and do you know that they're just by age alone, their testosterone levels are declining. All you have to do is ask one question. How are things in the bedroom? Open that door up, and the patient will discuss with you. You will find out that they will want to have treatment for their ED as much as their pain, like you mentioned. So this is not something additional. What I tell doctors when I train them, this is something you already do. You just have to ask a couple more questions to your patient. That and when you do a knee, you can also do the PShot as well. The same thing for the female. And if you do a knee, you can always do a little bit of aesthetic on the face. So with your question, let me give you an example. I have a patient about a year ago. No, this is 5 years ago. She came in limping because her hip was unbearable. She was walking with a walker, and walked into the door, and I came into the room, and then there's a sign in my office that talked about the vampire facelift. But she originally wanted to come to see me for a second opinion about her hip pain. And so as we were talking about, stem cell treatment, PRP for her hip, she pointed that sign and said, well, tell me about the vampire facelift. So I told her that's using PRP to your face and, help with the wrinkles, help with the color, make you look younger. She said, well, I want that. I want that first. I can only have this amount of money. I want that first before my hip. I go, don't you want get your hip done first? It's almost the same price. And you want to get your hip done first, so you can walk better. And it's not, and your hip hurts 24/7 with your face. You can have that result, but it doesn't pay you. But you know what she said to me? She said, I get up in the morning and I look at my face every day. All right. I don't look at my hip. I limp, but I don't look at myself. And my face is what everybody sees when they meet me, when they talk with me. So it was important for her to make her feel better and make her feel younger. So we did the face first, and she was actually in a way, help her with her spirit. She was able to be more lively and came back, about several months later to her hip. So that's a prime example to answer your question, is that sometimes vanity also outweigh what you need, even though vanity is what you want, but sometimes what we want outweigh what we need. In a lot of time.
I always say and teach, confidence is the #1 predictor of success. If somebody's prepared to deliver a speech, they're going to do better. If somebody's confident they can do well in something, they're going to do better. If somebody feels and embellishes more confidence, they're going to show up differently in many different areas of life. So I fully understand that. So Dr. Truong, thank you for the amazing gift of your time. This was fun. A lot of great insight, education, and for you all to think differently about solutions that are out there. Not saying that the other model doesn't fit as well. It's just some people want the best results in the fastest time and want to, get paid late and live forever. So, you know, Dr. Truong is a great person, a great physician that is dedicated to helping make that happen. So I'm really thankful for you, your friendship, and all the different training you've done for our colleagues and doctors out there. So wish you nothing but the most success. Congratulations on your continued entrepreneur goals and awards that you're winning. It's always fun to see somebody so talented making great things happen in the world.
Well, thank you, JR. And I appreciate your friendship and your continued success as well. And we've come a long way since we met a few years ago, where we are right now, actually, and we're doing our mastermind together. So I'm much appreciative to be here and to be helpful to your client or to anyone. And we're in Fredericksburg, Virginia, about an hour south of DC. And so stop by when you're hopping by on a plane or somewhere. I know you're traveling a lot.
Yes, Dr. Truong's a one of a kind. Very few out there like her. So go see her and see the brilliant practice she's created. And thank you so much, Dr. Truong. I really, really appreciate it.
Thank you, JR. See ya.